So, dear ministers, guests, honorable representatives of member states, distinguished experts, colleagues, ladies and gentlemen. It's an honor for me, as the Under-Secretary of State of the Ministry of Health of the Republic of Latvia, to welcome you to the high-level conference, Healthy Lifestyles, Nutrition and Physical Activity for Children and Young People at Schools, within the framework of Latvian Presidency of the Council of the European Union. With great pleasure, I would like to give the floor for opening speech to the Minister for Health of the Republic of Latvia, Dr. Guntis Belēvičs. Welcome.
Dear colleagues, dear guests of the conference, I would like to give you a warm welcome today in Riga in this high-level conference which is dedicated to healthy lifestyle of our children. I'm very happy that so important issues for public health are discussed within the European Presidency of Latvia, which is a great honor for Latvia. It is also proof that we have a common understanding about cooperation, about the future, and about the development directions in health. I would like to stress that our leitmotif during the presidency is a responsible individual with stress on healthy lifestyle from early childhood to old age. Research shows that children and young people who have a high body mass from childhood have a higher disease risk of chronic diseases. And also the figures about overweight children give rise to concern. We have 1/3 of primary school children in the European Union who have excess weight. Therefore, these 2 days will be devoted to the main topic of weight reduction strategies, food at school, healthy lifestyle, health in education, the importance of the school environment, physical activities, and innovative technologies for healthy lifestyle. We are experts in your areas, and you are going to agree with me that food policy, diet policy, nutritional policy has a very important role in the early age in childhood, because the taste that we, our first taste that we gain in childhood is a good foundation for our future life. And therefore it is important to learn to live a healthy life, which should become a leitmotif for future life. So a healthy lifestyle and healthy food is and regular physical activities are a basis for strengthening the health of our children and young people. Like with food, as we train children to be physically active, this is a basis that gives us assurance to know that the child is going to be active also during his whole life. I would like to invite everyone to discuss health promotion, because this is maybe our biggest contribution to economy. As we think about health and healthy eating, we should think about the health in all policies principle, which should guide both the governments and the municipalities and the civic society in all levels. We see that nutritional aspects should be related not only to health and education and welfare, but also to development in investment policy in the planning documents. So healthy lifestyle is a basis for long-term welfare in the European Union, so that, and this is important because the children, our children are those who are going to create our future. We have to think about ways how children would have a healthier life all across their lifespan. We have to think about the challenges that we have. And here, working side by side, I hope that we are going to mark our way for our strategic policy, so that the future of our children should be better and we would have a sustainable basis for public health. Dear guests, Latvia is a beautiful country, and I hope that it is going to stay in your memories as a wonderful place. Please have a look into your files, into your materials, and you are going to see that Latvia has all the 4 seasons that help us to be active over the whole year. So winter is a time for skiing and skating. Spring is a time when we can watch birds and go cycling. Summer is a time that we can spend on the beach and go out and spend our time outdoors. And autumn is a time when we can gather our harvest and collect the beautiful colored leaves. So you also have something in your materials that you can use for sending greetings to all your friends, and please remember to be active over your whole life. Thank you.
And now I'm delighted to invite Mr. John Ryan, Acting Director of the European Commission Public Health Directorate of the Directorate-General for Health and Food Safety. Please, you're welcome.
Minister, ladies and gentlemen, good morning. It's a great pleasure to be here in this very beautiful city of Riga, and also in this very beautiful new building, to participate in the discussions on this important topic of healthy lifestyles. Allow me to start by complimenting the Presidency and the organisers on their choice of theme for this event. As you may know, the priorities of health of the European Commission are promotion, prevention and protection. We believe that these 3 elements are essential areas of action to preserve citizens' health, which is a fundamental asset for society. We believe that health is central both for social cohesion and also for economic growth. Prevention in particular is an essential and unfortunately underused tool in our struggle to reduce avoidable harm to citizens and avoidable costs to our health systems and economies. In Europe, chronic diseases are responsible for a staggering 86% of deaths and more than 70% of the burden on our health systems. And yet, most of these outcomes are preventable. Let me insist on this point. The vast majority of the cost and burden of diseases is related to the conditions that we can, for the most part, avoid. Promoting healthy lifestyles in general and balanced diets, regular physical activity and moderate alcohol consumption are of particular importance to prevent most chronic diseases. In fact, a recent study on the performance of European health systems indicates that substantial health gains could be achieved if most of us led healthier lifestyles. There is a potential for an increase, according to this report, of life expectancy of up to 3 years. This is what we could achieve just by taking ourselves up to the highest level that we see in Europe. imagine what we could do if we could also raise that level in time. And despite this potential, too many children in the EU are consuming excess calories and remaining too much inactive. 1 in 3 children in the EU is overweight or obese at the moment. These conditions at a young age increase to a high proportion the chances of a future diagnosis of diabetes, cardiovascular disease, or mental health disorders. In addition, there is increasing evidence that school performance is affected. This is quite worrisome, as it further contributes to inequalities in health and in other fields. It means that this generation of children that is appearing before us, with a high prevalence of obesity, will have a higher risk of having a reduced quality of life both now and in the future. The good news is that there are effective ways to support citizens in leading healthier lifestyles. We know that smokers, for example, can be helped to stop smoking. We also know that we can significantly reduce the possibilities of becoming overweight or obese, or increase physical activity. It's up to us to act, the public authorities, the food and drink industry, NGOs, and parents and teachers. We have to ensure that our children are consuming more fruit and vegetables, limiting their intakes of sugar, moving and playing while reducing screen time and following proper sleep hygiene. We should build on what we already know works, ensuring that our children have access to balanced and healthy and tasty meals at schools and kindergartens, that they are drinking plenty of water and engage in regular and fun physical activity. I'm happy to note that this conference will highlight the role of schools and early interventions, but also in fighting inequalities, promoting physical activity, and using new technologies to support us in reaching our targets and being more efficient at doing so. Allow me to add a further note on social inequalities. There's a great imbalance between the magnitude of the health challenges that we face and the resources which are being used to tackle them. But other inequalities exist concerning health determinants in general and nutrition and physical activity in particular. One obvious inequality is regional. Different places in Europe struggle with different rates of obesity. Child obesity prevalence ranges from 8% in Romania to 25% in the UK. And we'll be working with the Member States at the Commission level to provide statistics and analysis in 2015 and beyond in terms of country profiles in order to allow comparisons of these regional situations. Other less discussed inequalities, but equally important, relate to age and to gender. And finally, the most vulnerable are most affected by the consequences of unhealthy lifestyles. Children, for example, have very little to say on what they eat, on how much they exercise. The old, the frail, and the hospitalized, too, often suffer from malnutrition in care facilities. The poor and the less educated frequently have lower financial and physical access to fruits and vegetables, to sports facilities, or simply find it more difficult to interpret complex labels and nutritional information. So therefore, when devising new strategies, we must better empower and protect the most vulnerable members of our society. Or in the words of the President of the Commission, Jean-Claude Juncker, those that constitute the 29th member state. In other words, the 29th member state being those who are unemployed. In the near future, we should work to give to all the largest scope of affordable health choices, in particular to the weakest socio-economic groups. Ladies and gentlemen, dear Minister, Here at this venue, we are all aware of these issues and challenges, but we need to further encourage stakeholders to develop action on important issues such as food reformulation, advertising and marketing, promotion of physical activity, and information and education. On the European level, we have a 2007 nutrition, overweight and obesity-related health strategy, encouraging partnerships involving national authorities, industry and civil society. Through the high-level group on nutrition and physical activity, the Commission has worked closely with the Member States to develop actions. A third joint action on nutrition and physical activity is now being prepared with the Member States in the context of the health programme. Its launch is planned for the middle of this year. I would also like to note that tomorrow will be exactly 1 year since we adopted the Action Plan on Childhood Obesity. Its aim is to halt the rise in childhood obesity by the year 2020. And over the coming years, working with the WHO, a set of indicators will monitor these actions to promote healthy diets and regular physical activity for children. In this way, we can see whether the plan needs to be adapted over time. However, encouraging healthy lifestyles cannot depend only on public policy alone. All stakeholders have a significant role to play, and we have to make sure that the approaches we have been following are still adequate. Faced with the existing evidence and the statistics, we do not have an excuse for delaying any action on this matter. A focus on prevention and promotion will bring benefits for the health of our citizens and for the long-term sustainability of our health systems. These policies therefore need to be defended. Let us today and tomorrow hear the views of experts, discuss in detail, and then take the best practices home. And then let us work in close partnership with stakeholders and put all the available resources to address nutrition and physical activity problems with the urgency they demand. Thank you very much, and best of luck for this important conference. Thank you.
Thank you, Mr. Ryan. And now I would like to welcome distinguished representative from World Health Organization Regional Office for Europe, Dr. Gauden Galea, Director of Division of Non-Communicable Diseases and Life Course. Please, Doctor.
Good morning, Mr. Minister, Dr. Guntis Belēvičs. I hope I pronounce your name closely enough. John Ryan, friend and colleague from DG Sante, ladies and gentlemen. My pleasure to echo John's words in the honor of being able to address this opening of this important meeting, and the gratitude that the presidency led by Latvia is giving such importance to an issue that is crucial to the epidemic of non-communicable diseases in the European region. In my brief opening, it is my pleasure to reinforce many of the messages you have heard from the previous two speakers. One is the fact that non-communicable diseases, also known in many European Union member states as chronic diseases, are the leading cause of disease and death in the European region. That issues related to nutrition and physical inactivity are fundamental risk factors that are, and we are happy to see this gaining increasing attention in our region. On a global level, this could not be more timely. A couple of weeks ago, WHO launched the global report on non-communicable diseases, the second after the first that covered, that was released in 2011 in the year of the UN High-Level Meeting Political Declaration. Needless to say, NCDs are not going down. They are the major killer, far exceeding any other cause or rational grouping of causes, and they are projected to grow to cause 52 million deaths globally per year by the year 2030. And as we look at the comparable estimates of non-communicable disease deaths around the regions, we see that Europe has a significant proportion. Having a more mature epidemic, we have already got a very large proportion of the global deaths that are estimated to happen every year, with 8 million deaths due to non-communicable diseases happening annually in our 53 member states. Globally, the burden of disease study that is developed by the Institute of Health Metrics and Evaluation in Seattle has been documenting the risk factors that lead to loss of disability-adjusted life years around the world. The key point is that of the top 20 risk factors, 15 are directly related to nutrition and physical activity. And so while issues such as obesity or diet low in fruits appear as independent risk factors, the grouping of risk factors that are related to nutrition and physical inactivity are far in excess of any other grouping of risk factors. Non-communicable diseases exceeds all other causes, and within non-communicable diseases, nutrition and physical inactivity are really important. Narrowing from the globe to Europe, we find that the statistics are even more scary. We have not only a mature NCD epidemic, but we have a mature obesity epidemic, in which the vast majority of our member states have obesity levels that exceed 20%, and that only 5 countries in the 53 member states have overweight levels that are below 50%. We have the red bars, each red bar in that polar bar chart represents a country that has a high level of obesity, and you can see that the level, at least 1/5 of adults being obese, is the rule in Europe, in all but 11 of our member states. Well, it's not just a problem of developing world, not just a huge problem in Europe among adults. It's a problem that starts at a young age. And we would like to think, and indeed this slide might mislead you to think that there is some declining trend. There is no declining trend. This is a slide of the prevalence of overweight among boys aged 7 years. It comes out of the Childhood Obesity Surveillance Initiative that member states run with the joint support of the European Commission and WHO. This is one of our very valuable collaborations and a unique resource globally. There is no other region of the world that has such an important source of data. Here, it's not self-reported figures, but with the investment of the member states and the support of the DG Sante, we have been following up a group of countries who are actually measuring height and weight in children at a very young age. So while this seems like it's declining, actually it is a snapshot of the level of obesity and overweight in these boys, and we can see that as a minimum 1/5 of boys at age 7 are already overweight. So there is no decline here. This is a very large figure, even for the smallest bar in this list. And at the other end, Greece and Italy lead the way with about half of their boys being overweight at that age. Going back to the issue of inequalities that John mentioned in his presentation, there's a very interesting inequality that as you go from left to right on this slide, you will see the same data as in the previous one, but broken down by age. And you can see that for each country, when they have measurements beyond a single age, you will see multiple points. But you will also see that there is a very interesting gradient from left to right, from Ireland at one end to Spain and Portugal on the right-hand side. And it is also ironic and somewhat paradoxical that the home of the Mediterranean diet, the supposedly extremely effective diet that protects our health, in this home of that diet, we have the worst statistics in terms of obesity. And there is something that tells us we need to go back to our dietary roots in the south and somehow level out this major inequality that we are seeing between countries. We have self-reported figures that are coming from children at a slightly older age, and adolescents, 13 to 15 years old, and this comes from the health behavior of school-aged children. And you will see here rapidly 3 slides from 2002, 2006, and the 2010 study, and I don't need to go into individual countries. You can see that self-reported overweight and obesity is increasing wherever the survey is being done, and that the increase that we are seeing is sharpest in the eastern parts of Europe. If we look at the behaviors according to guidelines, we find that in 24 countries, 1/4 of teenage 15-year-old boys are consuming sugary drinks on a daily basis. And in terms of physical inactivity, 1/3 of European adolescents aged 13 to 15 are not active enough to meet physical activity guidelines. The health consequences have already been covered by my predecessors, by the previous 2 speakers. We start with obesity in childhood. We end up with adults that die younger, that do worse at school, that have breathing difficulties, psychological issues, increased risk of fractures, hypertension. Their consumption of energy-dense foods and sugary soft drinks leads to later obesity, dental caries, and multiple measures of increased cardiovascular risk. You chose to go for school policies, and this is extremely important. I am very glad that the previous speakers also broadened the agenda to cover issues of marketing and the food environment and the support of physical activity. But fundamentally, the schools are a place where children spend so much of their time, and it is extremely important to take this theme of this conference seriously. School policies within a health-promoting school environment represent a priority in our efforts to improve the situation. Quick review: we need in school to use both the formal as well as the informal curriculum to improve the environment in relation to both nutrition and physical inactivity. We need to encourage proper nutrition from the home, before the school, during the day, and after the school, improving both the children's knowledge and skills, as well as the types of food that are on offer to them, or sold to them, or equally important, not sold or stopped from being sold or marketed to them. Also, there must be a measure and an opportunity of safety for physical activity. Within the formal curriculum, as quality physical education classes, active play during the breaks, and support for extracurricular physical activities. Europe has, in fact, already embarked on many policies. I mention only one, the school fruit scheme, where conscious decisions are being taken at EU level in order to try and promote a healthier food and physical activity environment. The school fruit scheme both models appropriate consumption of fruit, and is a win-win situation in terms of intersectoral language with agriculture sector, creating a market at one end and for healthy fruit and food at the other. We will be talking about the technical solutions throughout the conference. I'll just put this quickly in context of both the global plans that we are all committed to. We have a global action plan for non-communicable diseases and 9 targets, among them the target to halt the rise in overweight and obesity, as well as a comprehensive plan adopted also by the World Health Assembly on maternal, infant, and young child nutrition. Here in Europe, 2 years ago now, we worked very hard to translate both the evidence as well as the global mandates in the context of Health 2020 into a framework for a declaration for working on nutrition and physical activity. Health 2020 is the overriding European health policy framework adopted in 2012 at the Regional Committee in Malta. In that meeting, in that document, we have agreed on 2 major strategic objectives: that we should level out the inequalities, to reduce health inequity in Europe, of which we have seen already a number in this morning's openings, as well as to improve participatory governance for health and increase work across the whole of government to give people the right to full enjoyment of health. How does this translate into nutrition and physical activity action? It was the discussion at a ministerial level in Vienna, which then eventually led last year to the adoption of a European Food and Nutrition Action Plan, and we are also working very hard at a technical level and soon at a political consultation level to finalize a physical activity strategy. And this meeting is therefore very timely, as I'm sure that many of your conclusions will be directly relevant to the physical activity strategy that Europe will be the first region in WHO to consider this at governing body level, and hopefully with your support adopt it this September. Thank you very much.